Australians need COVID-19 booster after 6 months or considered overdue by ATAGI. The federal government says the major change, which it has accepted and referred to National Cabinet for state-by-state implementation, will not apply to international arrivals at the border. Federal Health Minister Greg Hunt said under the new advice from the Australian Technical Advisory Group on Immunisation, ATAGI, Australians would be considered up to date after receiving all the recommended vaccine doses for their age group. The new advice goes a step further, stripping people of their up-to-date vaccination status and classifying them as overdue 6 months after their second shot. Premiers and the federal government had been at odds over whether any changes to booster requirements would also apply to international arrivals. According to the Prime Minister, 93.9% of over 16s have received 2 doses and 46.3% of Australians have been boosted. The government places safety above all else, as it has done throughout the pandemic, and will continue to follow the medical advice in protecting Australians, he said. People under 16 years of age will continue to be considered up to date after completing their primary course of vaccination, while severely immunocompromised people aged 5 years and older require a third primary dose to remain up to date. But Victoria Premier Daniel Andrews indicated he might seek to impose restrictions on visitors who had not had a booster shot, which is currently available only in a minority of countries. It has also been reported that Queensland Premier Anastasia Palaszczuk could join him, despite having previously called for more support for the state's struggling tourism industry. We've got to start living with it. Let us be adults now, understand that we've got to live with this like we live in the flu and live with the cold and stuff like, he said. Dr. Chris Perry said while such a move seemed unnecessary at this point, it could be a smart move into the future. Meanwhile, New South Wales Premier Dominic Perrottet was tight-lipped on whether he would join his Victorian counterpart in demanding a 3-dose vaccine mandate for tourists. There has been a lot of discussion around it and, if that is the advice from ATAGI, then obviously from an NSW perspective, we'll be applying that here in our state, Mr. Perrottet said. My understanding is from what the Prime Minister said yesterday is that the requirements in relation to overseas travellers coming into Australia, that it would be the 2-dose vaccination that would be required. Mr. Perrottet also pointed out the advice National Cabinet was anticipating from ATAGI would relate to the definition of fully vaccinated in Australia, not to visitors. That is a different situation for those people coming from overseas in circumstances where they have different procedures and rules in place for their country, he said. At a later press conference this morning, he gave a stronger indication that NSW might still allow double-vaccinated travellers in regardless of the ATAGI advice for Australians. Contact us.